first of all, Obi, thank you so much for inviting me to be part of this video. I really appreciate it. It looks like you got an amazing list of people on this video, and I'm humbled to be part of it, so thank you so much. So my name is Harbir Sian. I'm an optometrist in the Vancouver, Canada area, and I am co-owner in two different practices, two different types of practices, different modalities. And the question I want to answer is, what makes an ideal optometric practice? Because I've been fortunate to practice in different settings and be a co-owner in two different types of modalities, I've had the good fortune of being able to kind of learn and understand what makes these different types of practices run. And I think the best way to answer this question is, what makes an ideal practice is whatever feels ideal to the owner or the kind of the lead optometrist to make it the type of practice they want it to be, because then they can kind of practice in their most authentic way. I think that's the most important thing. If somebody's practicing within a setting that's uncomfortable to them or doesn't really align with their values and principles, then I feel that that practice just won't grow and won't serve their patients as well as it should or could. So what makes an ideal practice is setting up the practice to really express your kind of best self as the optometrist. So here, in North America, we're very fortunate to be able to practice in various ways, different modalities, different specialties. It's actually kind of a blessing, to be honest. So we can pick and choose the way we want to practice to create the ideal practice, the practice that's ideal to us. So personally, I like to do my kind of family eye care, but on top of that, have a couple of subspecialties of dry eye or myopia management and other things like that. And other practitioners may choose to just pick one of those and focus on just one of those, and that would be their ideal practice. But as long as they're living their true self, practicing in their most authentic way, they will be able to serve their patients the best way possible. So what makes an ideal practice? It's the one that feels the most ideal to the doctor and the one that serves the patient the best.